blunt head trauma, bite wounds, retrobulbar hemorrhage, orbital fractures, at saka excessive restraint. No? Ito yung mga pangunahing dahilan ng traumatic proptosis. No? Ano yung mga kailangan nyo tandaan? Ano yung mga kailangan nyo gawin? Yan ang pag-uusapan natin today. Welcome back, guys. My name is Dr. Stresho. I'm an animal doctor, and every week we post cases, topics, tips on how to better take care of your fur babies. Kaya yung mga cases na na-experience natin sa clinic, no? Sinishare natin dito. But before we proceed, please hit the like button and subscribe to our channel para naman updated kayo sa mga future episodes natin na ipopost dito sa ating YouTube channel. Right? And also, you can share topics. You can also visit yung ibang mga topics natin na ginawa in the past and share them to your friends who are experiencing the same cases, no? Or if you yourselves are experiencing these cases, you can check them out. You can ask your veterinarian. You can consult as many veterinarians as you want, no? But ang importante is you are informed. No? So, today we are going to talk about traumatic proptosis. No? We will be presenting two cases. Number one, yung case natin si Peachy. So this is Peachy, 7-year-old female Shih Tzu. Nakipag-away kanina umaga doon sa mas malaking aso sa kanya. A little bit bigger, it's a Shiba Inu. Dinala dito kasi meron proptosis. Ayan, nalabas yung mata niya. But since it just happened this morning at hindi naman ganun kagrabe yung effect doon sa mata niya, we are just gonna put this back, no? I-repair lang natin yung mga sugat, so sinibate na rin natin siya. We're just gonna put it back together, and then this way masasave pa natin yung eyeball. So dinala sa clinic, talagang siya, frantic. She was in pain, and the owner was also distressed kasi nakikita mo nakaluwa yung mata ng aso mo, no? So, kapag ganito yung nangyari, huwag kayong matataranta agad. The first thing you need to do is cover the eye. Of course, the dog will sometimes resist because painful, masyadong masakit yan. Yung lalawas, yung mga masundot saglit yung mata, talagang masakit na, lalo pa yung lumawa. No? Plus, nagkakos na yung muscles nito around the eye, the orbits. It's actually already spasming, so talagang masakit na, no? Okay, so we did a tarsorrhaphy para dito sa aso na ito to temporarily close the eye, no? That way, it will give the eye enough time para makapahinga, makontrol yung swelling and inflammation, and cover the eye from desiccation and further infection, no? So that's the purpose of that. Primarily to induce and initiate healing process, no? So yun yung purpose nito. And then with medications na topicals and oral meds and anti-inflammatories, the eye will go back to its normal size and position, hopefully. Kung wala masyadong muscle damage do sa periorbital muscles, and hopefully we can be able to save the eye. And this dog can go home in a few days time. After the surgery, makikita niya, Doc, bakit parang banlag yung aso? So, mataas yung possibility na mabanlag yung aso because the muscles around the eye were stretched, no? So, kailangan pa nila mag-heal, kailangan pa nila mag-recover, and usually it takes around 3 to 6 months, sometimes up to 9 months for the eye to return to its normal position. Kaya huwag natin yan strabismus, lateral or medial strabismus. Usually lateral strabismus yung nangyayari. Common ang itong traumatic proptosis sa mga aso na brachycephalic, yung mga brachycephalic breeds, yung mga pangu yung ilong, no? Sino yung mga yan? Yung mga Pekingese, Shih Tzu, Pug, Boston Terriers. These breeds are highly represented pagdating sa traumatic proptosis. And yes, madalas silang makakita. Minsan nga, dinala. Hinila lang niya yung aso niya because lalapit ito dun sa kabilang aso for fear of, dog fight. Hinila niya yung aso niya. Lumabas yung mata. No? So, pwedeng mangyari yan. At saka kapag nakikipag-away ang mga aso na usually natatamaan yung mata nila, kakaroon ng laceration and it's already bulging. So, bakit nga ba itong mga brachycephalic breeds ay prone dito? Kasi malaki yung kanilang mata, yung orbital fissure is actually large, no? Plus mababaw, shallow yung orbit. Yung grab ng bone, yung facial structure dun sa eyeball mismo is already shallow, so affected na. Kaya madaling itong lumuwa, no? Hindi ganun ka-stable for this breed. So ano yung mga dapat natin gawin kapag lumabas yung mata ng aso natin? So first of all, don't panic. Kuha kayo ng cloth na malinis, basain, i-cover yung mata ng aso, no? If you have KY jelly, if you have petroleum jelly or mineral oil, no, pwede natin gawin yan. Pwede natin ilagay yan sa mata just to keep the eye moist, no? If you have ointment na walang steroids, you can also put that. That's actually perfect. And dalahin na agad sa veterinaryo. Huwag niyong pakainin. You can give water, yes, but don't feed kasi baka operahan na rin right there and then, no? So pagdating sa clinic, the dog is usually in pain or the cat is usually in pain. Kaya i-examine natin agad by visual examination only, malalaman na ng veterinaryo kung ano yung condition, of course. But usually gagawin pa rin yan ng blood exams to see if the animal is fit for surgery. Gagawa ng radiographs or x-ray, no? Titignan kasi baka may fracture, baka may iba pang lalo na kung may blood force trauma yung dahilan, no? Minsan kasi kapag nakipag-away sa mas malaking aso, yung mas maliit na aso, winawasiwas na ganyan, ibabato pa, no? So, the trauma, yung pag-bite mismo doon sa head can actually cause or fracture the head. No? So, binibigyan din natin ng pain meds. Sometimes you need to sedate a little bit, give some form of sedation para hindi mag-struggle, hindi maging frantic yung aso nyo. We can perform the examination right away. We can clean the wounds immediately, wet it, and give medications. No? So yan yung gagawin sa clinic. After all these tests, emergency surgery na agad yan. Na-mention ko kanina na kapag may mga ganitong eventualities, the longer it is that the cornea is exposed or the proptos eye is exposed, the poorer the prognosis. So, syempre, it goes without saying that mas maganda kung maibalik natin agad para mas maagapan yung further damage dun sa mata. So, okay, so this is Sasha, 4-year-old female Shih Tzu. No? Dinala siya dito sa clinic kasi nga, lumabas yung mata niya. Nakipag-away a few days ago doon sa kasama nilang aso. And nahagip yung mata. Yung mga aso na commonly luwa yung mata, like Shih Tzus, Pugs, Frenchies, yung halos nakaluwa yung mata nila are candidate for Proptosis eye. Ibig sabihin, lumuluwa yung mata. Some because of, minsan naglalaro lang sila, lumalabas yung mata. Minsan, nakikipag-away, lumalabas sa mata. If it happened recently, like within hours or maybe within 24 hours, usually na ibabalik natin yung mata, no? And just for aesthetic purposes, kahit hindi siya nakakakita, andyan yung mata niya. Now, on cases like it's beyond 24 hours, meron ng infection like this, like meron ng desiccation, kaya tinatanggal na natin. Candidate na to for enucleation. Yung enucleation, ginagawa lang yan kapag na-exhaust mo na lahat ng possibility na pwedeng i-save yung mata, no? Kung hindi na talaga salvageable, halimbawa, labas na yung kabila ng mata, putol na yung optic nerve, severely hemorrhagic, infected, yan ang dahilan para tanggalin na yung mata, no? I-close na ito temporarily because this will be cause of further infection. Tandaan mo, yung mata is very close to the brain, so infection of the eye can actually affect the brain directly because of the blood supply. Actually, 60 to 70% chance that the eye will be blind, lalo na kung severely affected ang optic nerve. Ano ba yung ibang mga dahilan kung bakit tinatanggal or ini-enucleate or tinatanggal natin yung mata? Halimbawa, yung may tumor, merong irreplaceable eyeball dun sa loob, no? Severe uveitis, o kaya yung end-stage glaucoma. So these are some of the possible reasons why your veterinarian would recommend enucleation. Sometimes, yung mga may-ari, hindi sila pumapayag kasi para ayaw nila mabulag yung mata. Sometimes, but you always have to think the comfort of the animal. Minsan, sobrang sakit na yung mata, lalo na yung may buktal mo, so yung uncontrolled glaucoma. So, ang laki ng mata, sakit niyan, para laging may nakasuntok dun sa mata ng aso nyo or pusa nyo. It's better for the veterinarian to remove. So it's better for your dog's eye to be removed than to make it suffer na lang, no? But in this case, ang case natin is traumatic proptosis. Nakipag-away, lumabas several days ago, hindi na natin pwedeng i-save, no? Kaya isinadjust na natin na tanggalin na lang. We perform the procedure.
Natin pwede na rin.
Okay, so si Sasha will remain with us for maybe a couple of days. And then several days after, okay na siya, napauwi na natin siya. So, anong take note natin dito? Eye injuries should always be considered as an emergency, lalo na yung traumatic proptosis, so inumuha yung mata, no? Number one, because it's painful, no? It can cause a lot of infection. Kung patagalin nyo, lalong lalala. It will determine the prognosis, no? Kung matagal. We can save the eye. If we can't save the vision, at least we can save the eye, no? And this should be done by an experienced veterinarian para maiwasan natin yung ibang complications after the surgery. Okay? So if you reach this point, congratulations. I hope this video helped you a lot. If it did, please hit like and then the subscribe button. My name is Dr. Stresho, and see you again next week.